welcome to Deuk Spine Institute. We're going to be live streaming spine surgery. Our patient travels here from Canada. He comes from Toronto, one of my favorite places to visit in Canada. Canada is a beautiful country if you've never been. Toronto is an amazing city. Great food, great people, great nature, and our patient travels here because he has pain in his thoracic spine. He's had this pain for 10 years. It bothers him every day. He's a dentist, so he tries to work on patients, leaning over them, but he's unable to because the pain is severe. And we determined that his pain is coming from two discs, T10-11, T11-12. He also has pain coming from his facet joints, T10-11, T11-12. Today we'll be treating his discs first, T10-11, T11-12 from the right side. And this is just local?
Yes.
Wow. If you have questions, feel free to ask me during the surgery. The first thing I need to do is gain access to the two discs we're fixing, which means I have to actually place a needle in them. Now, let's see here. Shot. It looks like we have a rib there, right? No, that's 1, so that would be 12. You agree? 11 and 10. So we're fixing 10, 11, 11, 12. Everybody's in agreement? Shot. It's too low. Shot. All right. So I'm probably going to make my first incision somewhere around here. Let's take a needle. We're going to go in on the right side. And I'm going to try to get into the disc. All right, let's go ahead and do a lateral view. Again, if you have questions, feel free to ask. All right. Now, I should be at the pedicle, which is what it looks like. There. Shot. I'm hitting bone. Shot. Shot. That should be transverse process, but it should be heading towards the right disc. So, wait, let me just think for a moment. Let's get another AP view and just see where we are. Quick AP. While we're doing this, if you want, Anthony, you can show the audience the how it is that a disc problem can be so painful for a patient. Sean?
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-69.
Welcome back. Thanks. Lateral. We're trying to get our disc in, a needle into the proper disc at this point, and I just need another minute, Sean, to do that. Sean. So we're at the first of the two discs right now. Let's take another AP just to be 100%. Quick shot. Interesting. That's interesting. It's pushing the needle laterally. Take that. So, I'm going to have to go again and see, Sean, if I can't get this to go more medial. Sean? You're doing great. Just lay still. Sean? Don't do anything. You're doing great. Sean? All right. AP. I need about 5 minutes more. Yeah. All right, let's do a little dye. Just a tiny test. And verify we're inside the disc. That's the most important thing right now. Sean? Yeah, we're in the disc. Give me a lateral view. You're doing great. Just lay still. We're almost done. Perfect. We're in the disc that time. I'm going to go a little bit higher. How are we doing, Anthony?
We're doing fine.
Sean? All right. Give me a second. Sean? You're lined up on that next disc nicely. Sean? 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 Give me an AP. Uh-oh. I'm going to come up from a little higher. That's amazing, huh? How big that disc is. Sean? Sean? AP? Lateral. Lung markings still look good. Breath sounds are good. Burn does. That looks pretty good to me right there. Sean? I don't think it gets any better than that. Sean? We're just about ready for discogram. I want to get another AP. Sean? That's perfect. You have more, or is this the only one? No. Sean, are you ready, Dr. Burndale?
How you doing, my friend?
How are we doing, Anthony? Where are we at?
You okay? Okay, we're going to ask you some
We
questions.
have
Are you having
5
a question?
viewers, but no questions.
This is discogram time. How you doing?
Don't tell him. Just make sure he's awake. All right. Hold on. Let me just think. Man, what is that? It's all just local? That's crazy, huh? Let me know when he's ready.
How are you doing? He said he's doing good.
All right. Do you remember we talked about this?
He said, what are we talking
Are we back here, there, Anthony?
Yeah. We're live.
All right. So before surgery, I told the patient, who's from Toronto, the man from Toronto, by the way. Anybody else see The Man from Toronto? Great movie. Yeah, with Woody Harrelson.
Right.
So the man from Toronto has had back pain right here in this box for 10 years. I looked at his MRI with him. We did a Zoom call, telemedicine. He was up in Toronto. And I said, yeah, your MRI is showing 2 discs that appear to be damaged. And so we determined that that's where his pain was coming from, along with the facet joints, which we're treating next. And I told him before surgery, we're going to test and see if that's the case. Are you awake?
He said yes.
He said, yeah. Are you having any pain? You are. All right. Is he reliable? How bad is that on a scale of 1 to 10?
Give us a number.
What's the highest it goes?
6, 7, he's feeling it.
7. Is that where you get pain?
Yes.
That's where we get the pain, right? 7 out of 10, and it's concordant. All right, that's one of the discs. Is it better now?
Is it feeling better? It's still sore.
All right. Did he get any funny juice? I mean, but is he clear?
Yeah.
Is it better? All right. How bad is that on a scale of 1 to 10? How bad is it on a scale of 1 to 10? What's the highest? 8. Is that where you get your pain? He said yes.
Yes.
So 8 out of 10. All right, my friend. You're going to go to sleep. When you wake up, we'll be done. That pain will be gone. I want you to count out loud from 1 to 100 for me. Can you do that? Count out loud.
2 for 2 today.
Start counting. Let's get a quick AP. So folks, we just verified that indeed the 2 discs we're fixing, number T10-11, 11-12, are the cause of his pain because it reproduced the pain. Let's see the lung fields. There's the disc. with steroid and numbing medicine is a good idea to confirm the diagnosis that it is your joint indeed and not something like tendonitis. If your joint is indeed the cause of your pain, then don't have a joint replacement. If the pain keeps coming back, come to Deuk Spine and let us do, actually we have a Well, I can wait as long as you need me to. Can I get a chair here, please, Hector? It's over there. Is that sterile? That field is sterile. I'm going to wait until Dr. Berndes gives me the A-OK. All right, so this disc is so painful for this patient that when I went into the tear, the painful tear, his heart rate dropped. We call it a vasovagal response. When a stimulus causes your autonomic nervous system to malfunction a little bit. Any other questions?
No questions.
He's back up at 64. How's blood pressure? Yeah, looks like it's recovering. Are we okay? Do you want me to wait? Wait a minute. We're going. Almost done. Let's see. Shot? That looks good. All right. So we are in where we need to be. He's doing fine. We're going to proceed because he didn't come here to lay on a table and get a metal spike drove in his back. So we have to finish his treatment. There we are. We're inside the disc. That's the herniation. Look at all that pink material. That's all inflamed annulus. Inflamed annulus. That is why we're here. Okay? That's the source of his pain right there. Take your time, Jordan. All right, any questions from our audience?
No questions.
Let's show the audience how we use the Deuk laser. Give him a hand. How we use the Deuk laser. Help him up. It's your friend. All right? When a man is on the ground, you help him up.
Ready?
Sorry, we're going to use the Deuk laser disc repair to repair this disc. Wow, it's amazing. I feel massive pulse wave pushing this laser backwards. Is this a new fiber or what's different?
It's not a new fiber, it's just
It's so powerful. Yeah, so have we, look at all the scar tissue here. Have we shown the audience how we do the Deuk laser disc repair?
How it cures thoracic back pain?
Yeah,
No, I can play that now.
let's do that.
Disc injuries are a common cause of chronic thoracic back pain. The inflamed annular tear causes thoracic back pain. A 1/4-inch size skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debreeds the annular tear. The advantages with the Deuk laser disc repair is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Back, folks, you can see how we use the Deuk laser disc repair surgery to repair a damaged disc that's causing pain. The part of the disc that's hurting is always the same. It's the back. We call it posterior. Anterior means front, posterior means back, lateral means side. This tear in the disc that's causing all the pain for this patient for the last 15, 20 years, the tear has been undergoing inflammation for all this time. And as a result of that, we call it chronic inflammation for 20 years. He's developed massive scar tissue, inflammatory tissue, nerve fibers that are growing in, blood vessels that are growing in. We call the blood vessels neo for new, vascularization, neovascularization. We call the new nerves neoneurulation, new nerves. And those new nerves that are growing in the posterior annulus, well, guess what? They're pain nerves. They're not pleasure nerves. You know, we don't have pleasure nerves that grow in from inflammation. Only pain nerves grow in from inflammation. So inflammation doesn't cause pleasure, it causes pain. And the reason it causes pain is to alert you, the being experiencing pain, it's to alert you to the fact there's something wrong inside your body. So, your inflammatory system creates pain to alert you of a problem, right? I mean, let's face it, of all the stimuli that we have in our lives, let's just take the shirt on your back or the dress you're wearing. After a minute, your brain has forgotten about it, right? You don't feel that shirt on your back. Hector, do you feel the shirt on your back during the day? No, nobody does. Because we become desensitized to that stimulus, the shirt. However, we do not become desensitized to pain. We do not. Therefore, pain is the sensation people feel when their body is trying to tell them there's something wrong. There's something wrong. Because your brain is not wired to ignore pain. You like that, Berndes? The brain is not wired to ignore pain. I'm gonna keep that. That's me. I just created that one. I like it. Anthony?
Yes.
You use it in your next blog.
Sure.
The brain is not wired to ignore pain. Okay? Therefore, pain alerts your brain there's a problem. You know, in the old days, like the Vikings, when they were being attacked, their village was being attacked, they would either build a fire to signal to their neighboring communities, hey, we're being attacked, come help us. Or they would bong a loud noise, right? So that would alert their neighbors, their friends, come help us, their allies. Come help us, we're under attack. Speaking of which, anybody see a movie called The 13th Warrior? 13th Warrior. My gosh. Shame on all of you. Luis. No?
I don't remember. Is it Knights? Is it Knights, the movie? No.
It's a,
Knights?
there's somebody in it,
No, but they are
Antonio
Knights.
Banderas.
But
No,
Knights-
they're Vikings.
Vikings.
Vikings. 13th Warrior. Be sure to watch it. Great movie. Old movie, one of the best. Anthony, you're disappointing me. Just like Henry did. But Henry was a little better. He at least watched some good movies. Okay? Folks, movies are an important part of our culture.
I mean, I like westerns. I mean,
Yeah, I understand that. But don't limit yourself to just westerns.
okay.
13th Warrior, epic Viking movie. And it's not like the garbage they have today, you know? People hacking and hewing, sitting around sipping tea, playing with dragons. This is the real stuff. As they say, the real shit. All right? 13th Warrior, Antonio Banderas. And shame on anyone who says they don't know who Antonio Banderas is. One of the greatest actors of our time, of our generation. All right, so here we are, almost finished. We're at T11-12. T11-12. We have T10-11 to do next. Any questions?
Yes, we have a comment from Cosmic Knight.
Cosmic Night. Yes.
I just want your opinion on the nerve block injections with the steroid for the pain in both hands.
Yeah.
I am also on blood thinners.
But it's okay. I mean, a joint injection in the hand is so minimally risky that as long as you have a good doctor who knows what they're doing, they're not going to hurt you and cause damage, okay? And it's just an injection. It's a steroid and numbing medicine. It will wear off. And it's a very small amount of steroid and a very small amount of numbing medicine. So the medicine itself won't harm you as long as the doctor is doing the technique properly and injects the joint. I like to use an X-ray machine during the injection, and I use a little contrast so that you can see it inside the joint. You can make sure you are inside the proper joint. You're injecting the medicine in the right place. So you do a small, like half a millimeter of injection, just to check the dye and make sure you're in the right spot. Okay? So I say it's a good idea to do it. At least you'll know that the joints are definitely causing your symptoms. All right, we're just about done. This is like literally a solid wall of scar tissue. You guys see that? This problem has been going on, based on what I'm seeing, for over 10 years. And the laser is the only way to fix this. There is nothing better. I've tried everything. I used to do fusions all the time, but the laser is the tool of the future. And you can only use it endoscopically like I'm doing. This is the only way it's really effective. If you just stick it in there without the endoscope, you're blindly zapping around. So you have to do a combination, endoscopic laser. And that's what the Deuk laser disc repair is. It's not just laser spine surgery, we're doing endoscopic laser surgery. Combination of the two techniques. That's the winning combination. It's like having Lionel Messi and Neymar on your soccer team, both of them. Okay, the two best, at least used to be the two best. I know things are different now. But back in the day, right? Which I'm sure those two would never normally be on the same team unless somebody paid for them to be on the same team. Anybody know what nationality Lionel Messi is? Argentinian. And Neymar? Brazilian. So, two of the greatest soccer players of all time. We are just about done here. But when you have those two, you have the endoscope and the laser working together, you're going to have a very high chance of winning. And that's what we want. We want the deck stacked in favor of our patient to win, to get rid of his back pain. All right, we have one more disc to go, and then we'll be coming and doing our Deuk plasma rhizotomy. I just want you all to notice that there's a lot of scar tissue. Hold on. Let's see here. What do we got left? I think I have one more zapping to do, and then we'll be done. So 1 minute, and we'll move on to the next disc. Any questions?
Yes, we have a question from Gary on YouTube.
Hi, Gary. Welcome.
Doctor, how do you deal with a case where a patient has a collapsed disc foraminal
stenosis.
Yeah, foraminal. At L3.
That's how all of our patients are, Gary. Every single one of them has a collapsed disc. The collapsed disc is not the problem. That never causes pain. Collapsed discs don't cause pain. They don't cause any symptoms. If your surgeon is telling you that, they're lying to you. Okay? Don't believe it.
Thank you.
And the other part of the question was, do you remove bone from the vertebrae or create space?
We do not remove bone. We don't remove muscle. We only take the herniation out that's stuck in the tear. That's it. And we clean the inflammatory tissue and the painful nerves out of the tear. That's all you need done. Nobody needs anything more than that. If anyone tells you you need more than that, they're lying to you. Okay? How do I know? I used to be a surgeon who did fusions all the time. And I would, before I knew how to do this surgery, I would tell people, oh, your disc space is collapsed, and you need to have a cage put in there, a spacer, and we need to put in screws, rods. But that's because I believed that. I didn't know how to do the laser. I didn't know the laser worked. So I just told people what I was told based on my training from my attendings, based on what the companies told me, the implant companies. And then I started to do laser surgery because patients with collapsed disc refused to have a spacer put in. They wanted laser. And I first told them, sorry, but I don't think laser is going to work. But they said, I don't care. I want you to do it anyway. So I said, okay. So I did the laser, and lo and behold, collapsed disc, stenosis, spondylosis, spondylolisthesis, all that jazz. And their pain went away completely with the laser. And it stayed away for the rest of their life. And that's when I realized we've been lying to patients. All these surgeons saying they have a collapsed disc and it needs a cage or a spacer or a new disc or an artificial disc or a TDR, all of them are not telling the truth. But it's not because they are lying intentionally, it's because they don't know any better. That's why. And they're not taught any better. They're not trained any better. I'll tell you when, you'll be able to tell when I'm at the disc. You just look at that monitor. All right? You'll be able to tell when and if I'm at the disc. Close your ears. You must have treated him well. Hold on. What'd you give him? A beta blocker?
Yes.
Oh, yeah, take it out.
Prophylaxis.
Yeah, it worked. Right? He's stable. Any other questions, Anthony?
We have a comment from Kat Kana. Oh my gosh. From
What?
Kat. We have a comment from Kat on YouTube.
We're going to have to get you a subscription to Ebonics.
I guess. Okay, today I did my rhizotomy level 7.
Okay. Well, I hope it goes well for you. Rhizotomy is a treatment that we do for facet joint pain, and I believe your doctors must have been treating your facet joints. So the only problem with rhizotomy RFA that we found is that it's temporary. It only lasts for a few weeks or a few months, and then the pain comes back. At Deuk Spine, we have a permanent rhizotomy, but we're the only ones with it. And it was pioneered here, patented here. So we can do a permanent rhizotomy. Keep that in mind. If your pain does come back, you have options for long-term relief with the Deuk plasma rhizotomy. And Anthony, would you mind putting a link in the stream, in the dialog box, for this person to check out the Deuk plasma rhizotomy? I don't know if you did cervical or lumbar or thoracic, but we're going to be doing thoracic Deuk plasma rhizotomy in about 15 minutes on this patient here.
Okay.
I got about 10 minutes left, and then we'll switch to facets. Good job, Hector. All right, any other questions or comments?
Yes, we have a comment from Cosmic Knight.
Yes.
I used to live in Argentina from 1978 to 1980. My mom was from there, and my dad was from Ireland.
Ireland. Wow, what a combination. Irish and Argentinian. That's beautiful. I love hearing stories like that. So, can I ask you who you identify more with, Irish or Argentinian? And please don't tell me you're a vegetarian. I don't know any Irish, Argentinian vegetarians. Argentina has some of the best meat in the world, huh? Churrasco. Yeah. I just came back from Argentina last summer. We went to Patagonia. I went there with my family. And love the country, beautiful. People are wonderful. I did not like the black flies. Those black flies are the most aggressive flies I've ever seen in my life. They're worse than, what are they called? Deer? No, what are they called here? The flies that are really aggressive? Horse flies. Yeah, we have the horse flies in America. They have these horse flies that are crazy on steroids. Honestly, they could be one of the creatures that fight Godzilla. But beautiful country. Anybody out here ever been to Patagonia? Of course.
Is it okay to discharge the first patient?
The first patient, no. No, I'm going to come out there and see him. Just let him have something to drink and some crackers. I want to come see him. I didn't get a chance to see the first patient. All right, we're just about done. Look at that right there. There's the painful tissue. We're ablating it, getting rid of it. I was commenting earlier about the laser and how powerful it is today. The laser works in two ways to do its job here for the Deuk laser disc repair. The first way is off of the end of that fiber, it's releasing laser energy right into the scar tissue, herniation that's right there. You guys see that? It looks like almost like a mimolette cheese, very thick cheese, very hard cheese. And the second way it works is by creating a pulse wave. It's a microscopic pulse wave. It's like a blast of energy like a very powerful wave that you can't see, and it disrupts the tissue. It blasts it. So after the laser cuts it, it blasts it out of there. And both actions are very important for this treatment to work. You got to have both. Any other questions? We're almost done. Have we shown all of our videos?
I believe so. And we have a question from Gary on YouTube.
Sure.
Doctor, how long is the recovery of numbness in the legs following piriformis release?
How long is the recovery of numbness in the legs following a piriformis release? That's a great question. If the piriformis release is done by me, and if you don't have another reason for having numbness, like a pinched nerve in your back, then the numbness should go away within probably a few months, 2 to 3 months. Right, but if you have a different cause for numbness, like neuropathy or radiculopathy, then it could take much longer. So it just depends on the cause of your numbness and where you get your piriformis release done. Some doctors that do piriformis release don't do it right, and the patients never get better. At Deuk Spine, our patients always get better with the piriformis release. Great question. All right, we're just about done. I've got 30 seconds more. We're going to end the stream. We'll be back in just another couple of minutes to do our thoracic Deuk plasma rhizotomy for thoracic pain on a patient who traveled here to Florida, all the way from Toronto, Canada. One of my favorite cities in Canada, along with Vancouver. Any other questions?
No questions.
All right. Well, I'll tell you what. Go ahead and end the stream. I'll do one more grab, and then we'll start up again in a few minutes for our Deuk plasma rhizotomy.
Ending the stream.